Okay, thank you very much, everyone. Welcome today for this talk on addressing environmental challenges to unlock health security. I'm once again going to very unfairly condense our panelists' long careers into just a mere few sentences, but let me just introduce them to you first. So at the end, we have Professor David Heymann. He's a professor of infectious disease epidemiology at the London School of Hygiene and Tropical Medicine. He was also the former executive director of the WHO Communicable Diseases Cluster. Next, we have Sir Collin Tukuitonga, who is the Associate Dean, Health and Medical Sciences. He's Associate Dean at the Health and Medical Sciences faculty at the University of Auckland. He was also formerly the coordinator of surveillance and non-communicable diseases for the WHO based in Geneva. We also have Professor Jean Tsai, who is a director and professor in global health and health security at the Taipei Medical University. And we also have Dr. Swee Keng Ko, who is the CEO of Angsana Health, a digital-first primary healthcare system in Malaysia and Southeast Asia. So if you could give them a round of applause, please. So I think in order to kick this off, let's look at the challenges, the dual challenges of climate and health security, and maybe David, you can help us help start us off in terms of how the One Health framework offers a sustainable solution to both of those problems, and maybe you can explain a bit about what the One Health system is.
Thanks very much, Jennifer. You know, we've just been through a pandemic, which has occurred because there was a virus from the animal kingdom that entered humans and spread around the world, and we've heard a lot about that in previous panels. And after that, people have been talking about One Health. And it's really important, I think, to understand what One Health really is. And One Health is a focus on three different areas in our lives: our environment, animal and plant agriculture, and human health. And if we can keep the focus on that, we're working with One Health, but we need to do more than that. We need to understand the factors, the risk factors, that cause the emergence of a new disease in humans. And that requires cross-sector work between the environment, animal and plant agriculture, and humans to identify those risk factors and to either mitigate or prevent the risks from occurring. And many of you will know about the Swiss cheese model, which is a good example of how infections emerge. Swiss cheese, as you know, is a cheese with holes in it. And if you want to pass an arrow through 4 pieces of Swiss cheese, you have to line up 4 holes. And those holes are lined up, and then the arrow can pass through the Swiss cheese. Using that with emerging infections, if you use those holes as risk factors, when those risk factors line up, there's the emergence or a public health event. And a good example of that occurred in East Africa and in the Middle East recently. In fact, this was involving Rift Valley fever, which is a virus, Rift Valley virus, carried by ruminant animals, sheep, goats, cattle. There's a vaccine to prevent Rift Valley fever. But that vaccine was not being used in East Africa because the production facility in Kenya wasn't able to continue producing the vaccine. So the first hole in the Swiss cheese, or the first risk factor, is actually the fact that there were no vaccinations in ruminant animals. The second hole in the Swiss cheese was an El Nino event. El Nino occurred in the Indian Ocean area, and there was flooding. And flooding led to 2 more risk factors that lined up. One was increased breeding sites for mosquitoes, and mosquitoes are the way that the Rift Valley virus is transmitted among ruminant animals, from animal to animal, but also from animals to humans. And in addition, the blood of those animals can infect humans. So there was an El Nino event, an increase in breeding of mosquitoes, and at the same time there was flooding, which caused animals and humans to become closer together. The result of the alignment of all those risk factors was a public health emergency, really. It was the emergence of Rift Valley fever in humans, which caused an outbreak and many, many deaths. Now, to prevent that outbreak, there would be many things that can be done in the short term and long term. In the short term, you could be vaccinating animals, and hopefully animals will be vaccinated in the future. But in addition, there are some mitigation factors, educating people about the disease, using mosquito nets to prevent mosquito bites. So that's the emergence in the short term. In the long term, though, there are other things that can be done, and that includes speeding up our activities with the climate change treaty, for example, to prevent events that cause flooding and cause emergence, and also at the same time to work closer with the World Trade Organization, because the follow-up to this outbreak was that unvaccinated animals went to Saudi Arabia and Yemen and caused outbreaks in those countries as well. And now in those countries they're having to vaccinate to prevent the infection in humans. So the emergence occurred, and that's the way factors line up. Closer here to Taiwan, there are typhoons, which continuously cause flooding and the risk and many times outbreaks of cholera. And there's rice, animal, and humans who all use antibiotics. Rice culture uses antibiotics to prevent certain blights, as does the pork and poultry industry to prevent infections in humans, and does the human community to treat infections. So we've got antibiotics in our environment which are selecting out resistant bacteria which then infect others. And so we've got a whole series of events that are happening in this area, as in the rest of the world, which are lining up the risk factors to cause an emergence. All of these and future events have long-term and short-term solutions. Short-term is good public health, but long-term is solidarity among people living on this planet. And that solidarity must lead us to understand how emergence occurs and to understand the solutions, but more importantly, to give these solutions and understanding to our political leaders. And that's why CAPRI is so important, because it's creating a solidarity among technical workers and people in this area, which will eventually develop the information which political leaders will hear. So that's what One Health is, Jennifer. I hope that's answered your question.
Yeah, absolutely. And you did touch upon Taiwan there, and maybe that's a good segue for Jean to make a comment about a Taiwan-specific issue in terms of the challenges that Taiwan faces in securing its health and climate security. So maybe you want to comment on that.
Okay, thank you first for the question. First of all, I would like to say it's my pleasure to be here in the panel. And also, it's a really exciting experience for me to communicate with the world in Taipei rather than in Geneva and also DC. So I would like to thank for CAPRI and also Shelley for the platform and also the opportunities. Regarding the issues and challenges of Taiwan face for the climate change and health, I would like to start from two facts of climate change in Taiwan. First is the temperature changes. So Taiwan is more and more hot over decades, like the other part of the world. And also, there are more frequent extreme weathers, for example, hot days or even cold days. And also, the frequency of a big temperature difference days within a short run is more and more increased. So we will experience the temperature difference over 5 degrees within a week, even more frequent than before. And the second significant point is the rainfall. Actually, the yearly average rainfall amount is not significantly changed in Taiwan over years. However, the days of rainfall is much more concentrated. So in some days, we will experience the difficulty of no water, like now, but also in some days, we'll have to experience the difficulties of heavy rainfalls. And those kind of two facts actually lead to at least three significant health concerns in Taiwan. And first of all, of course, due to the temperatures. So the hot weather actually brings the increased risk of heat wave and a heat stroke. And then the lower temperature and also the frequency of big temperature difference actually lead to the increased risk of respiratory and cardiovascular diseases. And this already be proved and also be observed in the data and study of Taiwan. And then secondly, the big challenges is the changing pattern of infectious disease, especially dengue fevers. And that is extremely, of course, famous also. So due to the changing pattern, previously dengue fever is the issues of southern part of Taiwan. But now we can even observe the cases happen in Taipei. So it's extremely the impact of climate change, which increase the challenge of infectious disease control. And also, like David mentioned, typhoon and the other things in AMR, and also the waterborne and the foodborne diseases due to those kind of environmental changes also increase the challenges of infectious disease control. And third point, it's the problems from the reduction of agricultural products. So because of those kind of climate change, the reduction of the agricultural products actually lead to the risk of food security and also the malnutrition issues in Taiwan. So we can already experience a little bit, and I think this is only the initial stage of these worries. So I would like to say that would be the three key areas that challenge Taiwan now. Thank you.
Yeah, and maybe it's a good kind of segue to Collin, so Collin as well, just to talk about the Pacific Islands in terms of the health and security challenges and how the two are interconnected. Could you maybe speak about that?
Well, thank you very much. It's a pleasure to be here. The climate crisis and all its ramifications is the issue for the Pacific Islands, and many in the region are a little bit annoyed about those who continue to deny that it exists. In the first 6 months of this year, I live in Auckland in New Zealand, and the first 6 months of this year we've had this dreadful weather, Cyclone Gabrielle and too much rain. And if it wasn't so serious, I find it amusing that people panic and don't know what to do. And I tell my colleagues and friends, actually, this is what the people in the Pacific Islands have to go through every year from November through to March. It's going to get worse, and get used to it. The three climate crisis affects pretty much all of, for the public health practitioners in the room, the determinants of health: the air we breathe, the food we eat, the water we drink. But there are three main consequences, I guess, for the Pacific Islands. The media and the public get very excited about severe weather events, tropical cyclones or typhoons, as you call them, severe flooding, and so on. It's always dramatic, and it captures the attention of people. And of course, it is a major risk to health. Fortunately, in the Pacific Islands, mortality associated with severe weather events is actually pretty low. And I think that's more a function of population density and scattered populations than any good planning. It's fortunate, obviously, that mortality is associated. Severe weather events, of course, cause a lot of damage. In 2015, severe tropical cyclone Pam decimated Vanuatu, crops, schools, infrastructure, some $700 million worth of damage. In 2020, Tropical Cyclone Harold did a lot of damage. So from a public health viewpoint, there are clearly risks, but it's obviously far more important in terms of the economy, people's property, crops, and so on. The second thing that happens that always in the media is sea level rise and stories of some islands, Tuvalu going under. That's rather dramatic, but clearly sea level rise is a consequence, and it will affect places, islands. In Fiji, I was involved in plans for relocating some 70-odd villages away from the coast. But these are obviously manageable. The one that probably is less dramatic and less visible and less in the minds of people is ocean acidification and warming and its damaging effects on coral and subsequently fish and sea life. Pacific Island people are people of the sea. 80% of their protein source come from fish. And if your food chain is compromised, people turn to tinned fish and rice and flour and processed food, which, by the way, is the second or first equal public health problem for island communities. And so ocean acidification and warming is a major problem in the Pacific Islands. As I say, there are clearly multiple effects of the climate crisis. People in the islands are a little bit grumpy with the rest of the world. This is an issue of social justice. Less than 0.03% of the harmful greenhouse gases generated by the Pacific Islands, and yet they're at the front end of all the negative stuff associated with the climate crisis. So there's an issue of social justice, and they've been very vocal at Global Forum about people needing to do the right thing. And I have to say I agree with them. And we need to act decisively on the measures that need to be taken to curtail, to curb. There's a lot going on in adaptation and mitigation activities in the islands, but you got to turn the tap off. And we haven't turned the tap off. I don't think that further scientific evidence, big reports on the impact of the climate crisis is going to help us. This is a moral, ethical, personal decision, and we really need to act more decisively. We're all in this together. It just happens that some people are much more exposed than others. Thanks.
Now, Sweet Kang, we've talked about a lot of things already. We talked about mortality, food security, malnutrition. How can we integrate all of these considerations, health security, universal health coverage, healthy societies, climate change, and One Health, as David spoke about, given that there are significant overlap between all of them, but they're not often discussed together? Maybe into that.
Thank you, Jennifer. Jennifer's raised several topics. So the first one is health security, which we can define. I'll start by providing some definitions and then providing a little bit of context on how to unite these very different themes in health. The first one is health security, which means protection from disease. Number two, universal health coverage, which means everybody should get the healthcare that they deserve when they need it without going financially bankrupt. Thirdly, there's health promotion, which is all the series of preventive and promotive activities to improve the health of societies and the well-being of societies. Fourthly, there's climate change. And fifthly, there's One Health, as David has explained earlier. These are 5 separate concepts. In any typical health ministry in any country, these 5 concepts usually have 5 different departments or units in the same ministry or agency that are responsible for each of the 5. And how do we get them to talk to each other and have a united, common, and shared vision? That is Jennifer's question. To answer this question, let me provide 2 thoughts for potential answers. And these are very boring answers. Why is it boring? Because government is supposed to be boring. When done correctly, governments are boring, which is good because you don't really realize that they're there. So the first step is public administration, and the second step, or the second solution to bring all 5 units together, is shared funding and shared KPIs, or key performance indicators. Let's talk about public administration. In South Korea, a country I admire very much, is the Ministry of Health and Welfare. In Japan, it's the Ministry of Health, Labor and Welfare, which means that health, labor, welfare, family, they're all interconnected. So that's one way to just change the public administration of a country to get all 5 pieces together. What are the 5 pieces again? Health security, universal health coverage, health promotion, climate change, and One Health. Another example about public administration is to break the silos within the independent units and the independent departments, even within the same ministry. That could be quarterly meetings at a director general level, monthly meetings at a director level, and so on. A third way, which is a little bit requiring a much larger political commitment, is to do what Japan did, a headquarters for health policy, which is a cabinet-level position reporting directly to the Prime Minister. These are all public administration changes which are invisible but yet get the job done. The second way to get all 5 parties together, and before I turn the floor back to Jennifer, is for shared funding. Meaning to say that usually these 5 sectors, then to repeat, health security, universal health coverage, health promotion, climate change, and One Health, most departments in any given ministry have the same problem of, my problem is bigger than your problem. So health security will say, I have a bigger problem than universal health coverage, and UHC will say, my problem is the most important one to solve before health promotion. So that my problem is bigger than your problem can be solved if you create shared funding mechanisms. This requires the Treasury and the Ministry of Finance to come and say, I will only give you multi-department, multi-ministry or multi-agency or inter-department, inter-ministry, inter-sectoral, whatever term you prefer. I'll only give you money if you have a shared program rather than having you compete with each other for the same pot of money. So these are 2 public administration ways, changing the organizational structure, but also secondly, changing the funding mechanisms to encourage more collaboration.
Great. Now, you mentioned this siloing, and I wanted to ask David, perhaps, when it comes to the WHO, do you think that the WHO acted quickly enough to reduce the impact of COVID? What could it have done better? Was this siloing, in other words, did that impact the WHO's response?
Well, thanks, Jennifer. I don't like to make judgments. I like to put the facts out, and I like people to be able to make their own decisions. And it's clear that WHO was notified about the pandemic, or about the beginnings of the pandemic, on the 31st of December or the 1st of January in 2019. They announced this to the world on their website, and countries in Asia, by the 21st, I know Singapore and many other countries, we heard from EK and YY, were already dealing with this as an outbreak that needed to be stopped. They were stopping outbreaks that occurred, and countries in this part of the world, in the Asia Pacific, really reacted rapidly, while Europe and North America seemed to just be sitting watching. And by reacting rapidly, they were able to keep the virus at low levels. Still, it entered the countries, but at low levels. And if you look at today at the mortality that's provided by WHO of what went on in the world, this part of the world had mortality rates about many, many times lower, about 500 to 600 per million, compared to 3,500, 3,600 in Europe and North America. So what we saw was that there was a rapid response here because the countries were on the alert. They were able to line up those risk factors in their national advisory boards, which said, we need to get busy and stop these outbreaks because we don't know what will happen in the future. So, and other countries in this area just closed their borders completely and prevented it from entering, waiting hopefully that they would have a vaccine at one time. So the judgment is for you to make, but the figures were there, and some countries reacted differently than others, and in the end we had a pandemic which spread around the world.
And going to you, Jean, when you look at it from an international legal perspective, what can be done to focus attention on health and climate?
So actually following David's previous talk, there are several international legal instruments actually related to health and also climate issues. So for example, the international health regulations under WHO and the UNFCCC for climate change, and also the regulations under WTO, that's all relevant. And although the international law have a well-known weakness as a law enforcement and also the painful, slow negotiations due to its multilateral natures. However, it's a way to show the consensus, broad consensus regarding the recognition of the issue and also the actions that have to be done. So study shows that not only the international regulations itself have the impacts on the national policy implementations, even the negotiation process actually bring the impacts on the national policy making and planning. So I would like to say from this viewpoint, even though there is a significant weakness of this kind of approaches, I think we should more aggressively or continue to use this legal instrument approaches to at least reaching the consensus among all regarding the issues and also the potential action moving forwards. And also talking that although a lot of people here in this room might say that globalization is almost die or already died, but actually you can see that after COVID-19, wow, we suddenly see again the international traveling. Like today, we have a lot of international travelers here, and that's the blessing that actually even though the geographical difficulties, but we still have the mindset in that we want to connect it with each other. So from that perspective, the globalization driven by international trade might bring, from the decades, bring the damages to climate and to the security of health also. But then it could also be a reverse approach for dealing with the issues. So currently, for example, the green economy approaches or green banking approaches, investment approaches could lead to a possible surrounding international regulations for this kind of activities. And I think that is also a way that we can try to talk on the issue, to try to much more collaborative approaches to solve the problems. And I would like to emphasize again here today that also due to the geographical politics issues, I think the regional collaborations is even more important than before. So we can considering to use the regional collaboration approaches through either agreement or the regulations to form the much more strengthened chance to secure all of us in these regions. That's my answer currently. Thank you.
Jean just mentioned a few of the problems that come out of increasing globalization, interconnectivity, and how that impacts the environment. And perhaps we can go to you speaking about just in terms of health systems accounting for about 4.4% of global emissions. So what can be done to reduce this figure and make health systems more environmentally sustainable?
Thank you, Jennifer. Excuse me. Health systems, they account for 4.4% of global emissions, like Jennifer has mentioned, and therefore healthcare systems and health systems are both a cause of global warming and a recipient of the damages from global warming. So it's a very difficult position for health systems to be in. Number two, philosophically, to decarbonize a health system is obviously important. Nobody will argue against that. We have to balance the acts of decarbonizing a health system with considerations of equity and access, meaning don't deny healthcare to people who need it just for the sake of decarbonizing. With that in mind, there are three ways. The first way for us to decarbonize the health system is to remove wastage, over-treatment, over-prescriptions in a health system. A specific example, one MRI scan. So if you've had an MRI scan before, that is 17 kilograms of carbon dioxide. And there is this phenomenon called doctor shopping. So when you see one doctor and then a second doctor and a third doctor, every antibiotic, every treatment, every x-ray, every MRI, every doctor's visit incurs carbon emissions. Therefore, if we can increase the efficiency, reduce wastage, reduce over-treatment, over-prescription, over everything else, we'll fix antimicrobial resistance, we'll fix healthcare costs, we can also reduce carbon emissions. As a crazy number, the US spends $4 trillion on healthcare a year. 1/3 of that is wasted. That's $1 trillion worth of healthcare is wasted every year. We need to reduce the wastage, and that will reduce carbon emissions. The second way is actually to move healthcare away from hospitals. This is a trend called dehospitalization. Hospitals are great, we love hospitals, but they're also very carbon-intensive physical buildings. The building of the hospital, the machines that are in there. If there's a way that we can shift care to the community, primary care, digital care, virtual care, that you don't have to attend to see a doctor, all these things are going to reduce the amounts of emissions, meaning to bring care to the community. That's the second way. And the third and final way, let's call it the standard net zero pathways. The UK, the United Kingdom National Health Service, has committed to be a net zero health system. They committed this in 2020. I think they've given themselves a 10-year roadmap. I think that health systems around the world should probably do a little bit more as well. Those are three specific ways that health systems can decarbonize. We haven't spoken about insurance and how insurance can drive decarbonization. We haven't spoken about private equity, the role of sovereign wealth funds like Temasek, and how these entities can also help the process of decarbonizing the health system as well. Jennifer.
And Going to you, Collin, in terms of the Pacific Islands, what is the relationship between climate, health systems, and thinking specifically about mental health? That's something that you want to talk about as well. How does that relate to Pacific Islands?
Everyone has an opinion on mental health and disorders, but we actually have, in the Pacific at least, we don't have good information on the nature and extent of the mental anguish and distress that people feel in relation to climate change. And one part of my day job is, in fact, we're part of a study into mental health disorders in Polynesian countries. So clearly we need to learn more about mental health problems, but there's obviously a lot of literature on the effect of climate change on mental health, anxiety disorders, manifestations of loss. One of the key issues for Pacific people is the prospect of being dislocated or displaced and to move elsewhere. People are concerned about that, and there are obviously a lot of conversations. But people are clearly reluctant to be relocated. They've lived in those villages forever. The dead are buried around the houses where they live, and if they move, what happens to their ancestors? A whole lot of those issues. So, as I say, there's no doubt that there are significant consequences of the uncertainty associated with the climate crisis. But we need to know better. Mental disorders are about, they're socio-cultural phenomenon as much as a medical health diagnosis. And we've got to be much more precise and well-informed in terms of devising responses. Pacific people are resilient. They've lived on these islands forever, and they know how to cope with adversity. They know how to manage risk. At the beginning, when I talked about low mortality, in fact, in Vanuatu, they thought the low mortality associated with 2 Cat 5 cyclones was as much to do with the traditional knowledge about how things happen and how they react to these things. So I guess the short answer, Jennifer, is we need to be much more sophisticated about mental health disorders and well-being so that we can respond appropriately. One of the worst things we can do is to overreact and label things wrongly and put in place measures that are unhelpful. So clearly a problem, but we need to do better by way of more precise knowledge.
Right, and thinking about being more sophisticated about tackling these kind of issues, that requires a level of funding, right, state-backed funding. When it comes to addressing the issues surrounding climate and health security, and I want to open it up to anyone to respond to this, is a different approach required for each country reflecting their income level? And can you maybe provide some specific examples? Anyone? Yeah.
Collin, do you want to?
I'm not sure that I fully understand the question. Clearly, for the Pacific Islands, given their small economies and limited resources, they rely heavily on the international sources of funding, and they have to be tailored in some way. The Pacific Islands receive a lot of official development assistance from Australia and New Zealand and elsewhere dedicated to mitigation and adaptation. The Global Fund is an important source of funding for these activities. But if you talk to people on the ground, of course, what's important is the ability to enable, to resource and to support communities to respond to the threats associated with the climate crisis. And so I think the Global Fund is a fantastic idea. I think people tell me that it's a bureaucratic nightmare to be able to access the funds, and it needs to be simplified in some way. So clearly, in terms of resources, at least for the Pacific Islands, people are accessing the resource that's required.
Maybe I'd add a little bit. You know, no country is free of the risk of an emergence of an infection. No country. And we saw that when people were watching the Asia-Pacific area for H5N1, bird flu, avian flu, back in the early 2000s, there was a feeling that that would become the next pandemic. People were very concerned, watching closely here. And what happened? It emerged in the southern US, northern Mexico. That was the pandemic that emerged of influenza. It didn't emerge where people were looking. So we just have to understand that you can't predict when infections or when anything will occur. It's the lining up of those risk factors that's important, and they can occur in economies that are very highly developed and in lesser economies.
Okay, so I try to answer these questions. I think I would like to learn from the previous panels that actually the solutions for each country is, however, have to adapt to the unique situations of the countries rather than only the considerations of income. So, for example, the culture and also the environment and all the social norm and all the things that they so every country might have their own unique or significantly common parts, but also specialize in their own national concerns. And so I would like to also share some information with SK that actually for Taiwan, we're also trying to have that cross-sectional collaborations for the issues. For example, our Ministry of Health is becoming a Ministry of Health and Well-being. So we're trying to enlarge the scale of tackling the issues. And also for this climate change, now currently we have a response strategy under the umbrella of sustainability and also net zero emission policies. So we try. So of course, I think the common issues around the world, especially for the countries who already start to try to solve the problem is that if we respond fast enough, or if we have a strong leadership regarding the direction enough or not. So I would like to address the issues from that perspective. So there are already countries moving forward, and for those countries, we should move faster and trying to tackle what's the difficulties, why we cannot move forwards. And for the countries who did not start yet, maybe we can try to start to front the raising out the awareness of the importance, and also strengthen the capacity that they have the capacity to deal with the problem and respond to the problems also. So that's my answer.
Thanks, Jennifer, and thanks, Jean. I'm glad that Taiwan is shifting to a new ministry name, and hopefully there'll be a lot more well-being in Taiwan the next time we're here. To go back to Jennifer's question is, should there be a one-size-fits-all solution for all countries to mitigate climate change? And the answer to that is no, based on what Jean has mentioned in that analysis. Let me add a call to action for high-income countries and countries with a technological sophistication. The call to action is as follows. While we can set global standards for like nationally determined contributions, according to the Paris Agreement, we must decarbonize X percentage of our economy, etc., any examples of global standards must be matched with donor funding and technological transfers in a way that builds the local capacity in low and middle income countries. Not just I give you the tech only without helping you build the capacity and the human capital and the systems to be able to absorb that technology. Meaning to say that high income countries and technologically more sophisticated countries have a moral duty, also a philosophical, ethical, scientific duty. Not only that, I think there are also commercial opportunities if done correctly in order to help, say, less developed countries as we move up the value chain, if I can use this word, to fight climate change together. Thank you. Jennifer.
So we've got about 6 minutes left, so I just want to leave the panelists with enough time to make some closing remarks. But maybe we can take a look forward. In terms of health and climate surveillance measures, how can those measures be supported at a global, regional, and national level? What actionable steps can we take?
Well, at the global level, certainly we need to do more to get health involved in the climate change discussions and in the treaty. And we've not done a good job of that. We've not gotten the political leaders to understand the real impact of the environment and these changes that are occurring in health. At the regional level, dialogue such as this is extremely important to bring everybody to the same level of understanding, including the political leaders. And then at the national level, such activities as joint risk assessment between the environmental people, the agriculture people, the human people, working together once a month, looking at those risk factors, looking at how they might align, look at the Swiss cheese model, and then try to interrupt some of those risk factors so that events don't occur. So there's importance at all three levels. Collin, yeah.
Oh, just to add, within the Pacific, there is a thing called the Pacific Public Health Surveillance Network, started in 1986. Australia and New Zealand are part of that, but it's within the Pacific region. And they rely, of course, on the global arrangements to transmit the information beyond. There are questions about laboratory capability and areas for improvement, but there is in place a mechanism that's worked, at least for the Pacific Islands, in terms of alert and early warning.
Okay, so from the global level, I would like to echo a little bit that the surveillance systems, cross-disciplinary approaches to collecting the information regarding the issues would be a really important step to move forward. So now, we are from the human sector, comparatively, we've done a good job, but from the environmental sector and other agricultural sector, especially from the viewpoint of our One Health approaches, actually the data is only for human currently. So for the environment and for the animal, I think globally we can do more collaborations for this kind of surveillance. And for regional, maybe it's a starting point, at least for today. It shows that there is a strong commitment for the regional collaborations also. So there is a need also for the regional capacities buildings for not only the surveillance data collection, but also for the possible collaborative approaches for the policy level to move forward. Because those kind of regional approaches would share the similarities of this kind of concerns in the region. So that would be the way that we can try. And then I guess CAPRI can play a important platform, or the current platforms if it's supporting the current platforms like EPEC or the others. And for the nation, I think at least when we see the regions, there are several countries like Singapore, Korea, and Taiwan, or even maybe possibly Japan, already start over this kind of approaches to move forward. So I have a positive viewpoints regarding the potential futures, and hopefully the leadership will be there, and also the collaboration will be much more permanent there. Thank you.
Thank you. Jennifer's question is about surveillance. So I'm, in a sense, sorry, I was going to say I'm pro-surveillance, but that's tricky. So what I might say is that surveillance requires the collection of data, which is very important. We're all pro the collection of data for public health reasons. Number two, the data should be shared. And thirdly, the data should have actionable insights rather than just collect data for no reason. Let me set all that aside, right, and offer three sets of facts about how the world enforces compliance. Meaning there are various international treaties like the International Health Regulations, they've got the Pandemic Accords, we've got the Paris Agreement, various other international treaties, too many to name. And the world can enforce compliance and therefore surveillance in three ways. The first one is self-assessment. We assess ourselves, or countries assess themselves. Number two is to have peers assessing each other, like Malaysia, where I'm from, middle-income country, we assess another middle-income country, example, Indonesia, Thailand, and then they also assess us. Thirdly, will be an external review. What that means is we get an independent third party to come in and review. So the self-reviews have taken place, for example, the Joint External Evaluation of the World Health Organization is an example of a self-review, or the Universal Periodic Review of the Human Rights Council, also an example of a self-review. An example of a peer review would be the World Trade Organization's Trade Policy Review Mechanism. An example of an external review would be the International Labour Organization's reviews of labour rights and policies, and also the Paris Agreement's nationally determined contributions. Finally, there are the very invasive reviews like nuclear weapons or Organization for the Prohibition of Chemical and Nuclear Weapons, that's very invasive, right? You go into a country without consent. That's a separate conversation. The point is that there are multiple ways for us to enforce compliance, not just surveil. Surveil's important, but accountability and mutual shared responsibility and appropriate trust, but verified mechanisms are equally as important. Thank you, Jennifer.
Great. I'm afraid that's all we have time for today, but please give a round of applause to our panelists.